Hey, it's me, Jen again, and today I'm going to be talking to a fellow RFA patient. Stick around. Thyroid nodules are super common, so I know you know someone who's got them. So make sure that you share this video with them and like it and subscribe and hit the bell icon. Do all of those things, then stick around and watch the rest of this video where I talk to a patient who's had thyroid RFA, a non-surgical procedure to treat thyroid nodules. She's going to tell us her story about how she kept her thyroid intact and how she preserved her voice too. Let's talk to Josemily. So Josemily, would you tell us a little bit of the history behind your thyroid nodule? How it was discovered, how long that you had it, and what were some of your symptoms that you were really struggling with?
Well, I noticed that I was kind of having a lot of neck tightness, and that was about close to 5 years ago. And I used to be very active. I was working out couple of 3 or 4 times a week, and I noticed that I wasn't losing enough weight considering the amount of workout that I was doing. And I went to my primary care and I asked him about my thyroid. So surprisingly, he noticed a lump while examining my area, right here, my neck area, and I was letting him know that at night I will wake up. Some of the symptoms was waking up in the middle of the night, like if I was choking, and like that tense in my neck all over here. It was just unbearable sometimes, especially whenever I would talk a lot. Like I was, at that time I was working as a front desk agent at a hotel where my voice was used very often, and sometimes what I noticed was that I will have to force my voice, and people were complaining that I wasn't loud enough, or like they couldn't hear me. So I mentioned that to my doctor during the examination, and he sent me to check my thyroid via sonogram, and they noticed that I have a lump on the right side, and it was a nodule. So then he sent me to a endocrinologist, a surgeon as a matter of fact, just to check if it was affecting my hormones. And in fact, this was just growing and not affecting my normal. My hormones are normal, and so I actually don't have any problems with my hormones, but it was just the fact that it was growing and it was affecting my body physically. And I noticed that it was growing, like I noticed that I was getting tired. Yes. And I couldn't get enough sleep or oxygen. So he actually sent me to an ENT doctor to check about my airways too, to see if I have anything with my sinus and anything related to my actual throat. So I went to an ENT, and that's when I actually went to 2 different ENT. The first one, they told me that I have a GERD. And I'm like, okay, but that was still like the GERD wouldn't affect my neck, because it was like really, the pain was so much that it was more like a tension pain, but it was very bothering, and I had to take medicine for this. And I started developing snoring too, because I couldn't breathe at night because I felt like I was choking a lot. So I was like, wait, I don't feel that it was the right diagnosis on top of the thyroid that I was developing. So they told me, I went to Bellevue Hospital here in New York to another ENT, and they told me that I have vocal paralysis on the left side. Wow. So at least the nodules were coming up on the right side, and another nodule was developing above the one that was already growing. So I had a 3 centimeter nodule on the lower right, and then a 2 centimeter nodule on the upper right.
Wow.
And then I have another one on the left side, but it was this one, when I got my RFA, it wasn't touched, because it's really not affecting my voice or anything. It's just there, very tiny. So, but this, whenever I had my RFA, that's whenever this was treated and shrunk.
Wow, that is very interesting, because my story is not the same as yours, but it is very similar, because I have one very tiny nodule on the left side and then one very large nodule on the right side. And I had that same symptom you were talking about with the pain and the swallowing and feeling like you're choking at night when you're sleeping. And that's just terrifying. Did you ever wake up in the middle of the night like trying to gasp for air? I had that happen
Yes.
to me some.
Yes, often, almost every night.
Oh, it's
And
terrible.
I became panicking whenever I had to take supplements or
Yes.
or capsule. I would be like, okay, 1, 2, 3, and I would like kind of hydrate my throat first and then see. But there were a couple of times where I felt like or the pill will get stuck in between, so I had to like drink half a gallon of water. But it was very traumatic, and I was like, no, I need to find some solution other than surgery, which was at the moment the only option that the endocrinologist was offering me. And I was just very scared, because I have only one vocal cord, and then on top of that I developed keloid, and I was just very concerned about the healing process, and what if I lose my voice? So I'm like, no, that was out of the question, having surgery.
So you were driven to find some sort of alternative to surgery. That was very similar to my story as well. I had a terrible background with some poor surgical outcomes, and so I was the same. RFA was this wonderful alternative to me because surgery was just a non-starter. How did you discover RFA? Did you just stumble upon it, or did a doctor tell you about it?
Well, because I wasn't happy with the prognosis from the ENT and the endocrinologist. I was looking into Columbia University Medical Center. I was like, you know what, I know that they have amazing physicians and doctors there that are doing miracles almost every day. So I'm like, I need to check if they have someone that they could help me with this. And I looked for Dr. Alciello, John Alciello, who is my endocrinologist at Columbia Doctors, and he recommended me going to Dr. Jennifer Poole. So she was the one that later on she recommended that I was a candidate for RFA because my nodules are benign. So she was the one that introduced me to this option, which I'm very thankful for.
Yes, absolutely. Yeah. Well, can you tell us a little bit about your RFA consult? What did Dr. Poe talk with you about, and did she do any tests or blood work on you during that time?
Yes, she did 2 biopsies just to confirm that they were still benign, and there were still some calcification, which was worrisome to her, but she went ahead and said, she assured me that it wasn't cancer. So she did blood work, and she mentioned to me that it was very minimal. I wasn't going to have any incision, or it was just going to be a thick needle going into my the area where it needed to be shrunk. It wasn't painful at all. It was going to be in the operating room, and I was gonna have local anesthesia, which helped a lot. Yeah, so, but it was still determined that I was a good candidate.
And then how long was it until you had your actual procedure? And tell us a bit about the procedure day itself too.
Well, the procedure day, I believe it was a week or 2 weeks after my evaluation. So it was kind of fast and I was getting nervous. She made me I felt very comfortable and secure.
That's great.
Yeah, so it was very smooth, and it was gonna take about 45 minutes. They put some lidocaine around my thyroid area, and a couple of minutes later they put the local anesthesia right in my thyroid, and it wasn't painful at all. But the actual like whenever it was inserted, the thicker needle, it wasn't uncomfortable at all.
Wow.
Not at all. Like it was just, I was just there, just, you know, the only thing that afterward panicked me a little bit, it's like a little, because you hear the crackle, like crack, crack, crack,
yes,
whenever it's being shrink. So yes. I was just a little nervous about that, but then she was just telling me, you know, no, it's fine, it's working, it's very, so I felt very safe and very comfortable throughout. It was fine. So it was safe. Once I saw, like, I look at myself in the mirror, nothing, like, I didn't see anything. It was just like when you get a vaccine or you get blood work, that's how it is.
Did you have to take some downtime, or what was your recovery like? Did you take any medication to help with pain or soreness, or use ice packs, anything like that?
Yeah, it was recommended to use ice, which I was given ice pack as soon as the procedure was done. And I used that for 2 hours, ibuprofen for the pain, but in fact it was very minimal pain afterward. Like it felt like whenever you do a biopsy in your thyroid. And I've done thyroid biopsy without anesthesia, so it was fine. No soreness, which I was scared about. No marks, like you could see that I don't have anything.
Wow.
And it was right here. The only thing with my procedure was that she had to stick the needle a little deeper because the nodule on the lower right side, she said that it's very deep. So she was telling me that if it doesn't work this time, I might have to get it again because it was so big, like, and it was deep. But no medication, like I don't have to take or take a couple of days off. I didn't, nothing like that. I went ahead the next day to work. I was able to talk fine. My voice, she actually told me that I could be hoarse a little bit. Nothing at all.
Wow.
So yeah. So it was, I was very happy. I was actually like you go in with another thought, oh my God, it's gonna be, because once they tell you you're gonna go into an operating room, you panic. Yeah. But no, it's like going to check to get a biopsy done, basically.
That's great.
And Dr. Guo was like very gentle, and she actually put music on. So it was very relaxing. It was very good.
That was my experience too. We had music in the OR where I had my procedure done, and I was like, oh, this is so nice.
Yes.
It puts you at ease, doesn't it? So, well, did you have any swelling? Did you notice any changes in your neck right away? How's your neck looking now compared to the way it looked before?
It's smaller. It is smaller. Like, it's very, very surprisingly smaller.
Yeah.
Because I used to have a big lump right here. It will make me self-conscious. But now after the procedure, in the couple of months later, that's when I noticed that it was getting smaller. So I'm very happy with that. No, like I think I had a little swellness for like 1 or 2 hours after the procedure was done, but you could see the effect of the RFA, like I would say the month between the first 3 months.
Wow.
You notice the change. Yeah, it's very it makes a big change in your system, in your body in this case.
Well, what about all those symptoms you were having, that choking sensation, and how's all that going?
I don't recall after the procedure like being waking up because I was choking. I really do not recall that. Like, it's been a while, and my neck doesn't hurt anymore, thank God. I'm very happy about that. It really doesn't bother me at all. And another symptom that I used to have was itchiness all over the place, and I'm like, I will always look like this. But that was because it was pushing against my skin, and it was very uncomfortable. But now I do not have any of that.
Wow.
So yeah, that's I'm very happy with that. And my sleeping habits have completely changed. Like I said, I don't wake up in the middle of the night feeling that I'm out of breath. Even the pillow would bother me. Like, I would have to sleep on the left side because the right side was bothering me. So no, I don't have any problems with my neck anymore.
That's amazing. I know exactly what you're talking about. Where I had to sleep only on my right side because I could not breathe if I laid on my left side because everything was being pushed over, and so when I would lay on that side, it would just close off. And so laying on my right side got to be kind of bother because I wanted to sleep on, I'm a side sleeper. I wanted to sleep on both sides and I couldn't. And when I noticed that my neck had started shrinking enough that I could sleep on both sides again, I was like, oh, this is great. And now I don't even think about it anymore. It's amazing how when you feel better, you stop thinking about the things that were bothering you in the first place.
That's true.
So, Josemily, tell me about if you've had any follow-ups with Dr. Quo, and what did you learn about what's changed in your nodules?
Well, I had my first follow-up in January. Did a sonogram to measure my nodules. The one on the left side, she told me that it was shrinking. So it could be because of what she did on the right side that it was affected on my left side. But she did tell me that my left nodule is shrinking. Another thing is that the upper right, in January, it shrunk by over 50%.
Wow.
And yes, that was the one that was 2 centimeters. So it shrunk about 50%. And then the lower one, the one that was between 3 centimeters and 4, it was shrunk by 30, almost 40%.
That's amazing. And that's
38, 40%. So it was a big change. To me, any change counts.
Yes.
So I was very happy. And again, my hormones was normal. It didn't affect anything. But I did start feeling the pressure coming off of my neck. And my sleeping, that's when I started developing better sleep habits, and I was able to breathe. And people were starting to not complain about my voice.
Oh my goodness.
Those complaints were shrinking too. They were less. So I'm very happy about that. And then I did go in July, due to the COVID-19, I was supposed to go back in May, between April and May, and I wasn't able to go, but I went in the beginning of July, and she told me that my upper right was 93% smaller.
Wow.
Since October of last year, 93% smaller. And the lower right was 87%
wow.
smaller. Yes.
So
compare from October.
I would assume then that Dr. Kuo would consider your case a success.
Yes. Yeah. She's very happy with the result.
Yes, I would imagine.
And
so.
I'm very happy that I was able to trust her care. It made my life much easier, and I'm able to take medicine. So I'm happy. My supplements.
Yes.
So that I don't mind the big one. I don't mind, like, even an aspirin I was scared to take, because I was scared that it was going to get stuck in my throat, and I would choke and I wouldn't be able to know what to do.
It's terrifying.
But I feel, and also when I go out for jogs, I am not hyperventilating anymore. I'm able to breathe almost normal. Like when you're running, that was very important to me.
That's incredible.
So I'm not I'm not fatigued, like I'm not short of breath anymore. So and my voice, even as early like in the morning, my voice is clear. Like I don't have to hydrate all the time, because I feel like I'm losing my voice. Yeah.
Wow. That's wonderful. It's good that you were able to have this procedure. I'm not sure, when you had your appointment with your ENT, when they were discussing having your thyroid taken out surgically, if they went over the risks with vocal cord damage from that surgery. But for me personally, that was a concern as well, because I had actually encountered a woman in the lobby at my ENT's office who had said she was speaking with someone else, and I could hear her voice was really having trouble. I said, pardon me, what did I hear you say you had your thyroid removed? And she said yes, and my voice has been damaged from the surgery, and now I'm having to go through vocal cord rehab therapy. And
rehab.
Yes, and I was just like, oh dear, that sounds terrible. And I said, how long has it been since your surgery? Thinking it had probably just recently happened. No, it had been months and months prior that she had this surgery. So I'm very glad that you didn't have to worry about those risks, given the fact that you said that one of your vocal cords was paralyzed, and I know that was an important factor to you. Did Dr. Kuo say that your nodules are resolved to the point that you won't require another RFA treatment?
Yes, she did mention that. I won't need it. The measurements have been so big, from 3 centimeters to now like less than 1 centimeter. It's very big difference.
Yes.
So she hasn't suggested that I need to get another one.
That's great. And you said you had that done last year in October in 2019?
The second week of October 2019.
And are you going to check back in with her at the October mark of this year?
Yes, October 5th.
Okay.
Yes, that's my next appointment. Hopefully I won't have to go back to check that and be informed that I have to get another procedure. That will be
Well, please let me know what you find out at that appointment in October. I'm curious to know if it's even shrunk even more since the last time you had it looked at. I'm just so thrilled to hear your story and how positive it's been and what a change this has made in your life. Would you recommend this procedure to other people who are struggling in the same way as you? And tell us who you think would benefit the most from this?
Well, anyone that has the same experience as we have are being suggested that, you know, they have to get surgery and they have to look for this alternative and give it a try first, because most likely you will not have to do the surgery. It's very safe, it's long term, and that's what the advantage of this is. The side effects are minimal to none. So that's a big change. Instead of you getting surgery, I really recommend this.
And you know, I'm sure you were very happy to be able to keep your thyroid intact as well.
I know. yes. I know someone that she had her thyroid removed a couple of years ago, and she has to take medicine for the rest of her life, and that was not the option that I was looking for. I don't have to deal with medication. I used to compare my tightness in my neck, like if I was having a panic attack, and it was actually physiologically that it was bothering me internally.
Yes.
So by having the RFA, like it made a total change to my life and my way of living. I'm able to do things that I felt like I wasn't able to do, such as running. Like I would run 1 or 2 blocks and I was out of breath already, and I had to start walking. Now I can run non-stop for several minutes, go up to 20, or if I can push it to 30 without feeling that I'm suffocating.
That's amazing.
So I feel very happy. Yeah.
And
this is all because of the RFA. I'm so happy.
You're the first patient interview that I've done so far on this channel, and it's so exciting to me to hear your story because there's so many parts of your story that overlap with mine. You know, and I know there are many other people out there who are going through the same things that we've been going through, and you know, that's why I'm not going to ever stop talking about this because it's
me neither. It's a life-changing procedure, and it's non-surgical.
Yes.
Which is which is a lot of people are scared of getting surgery.
Yes.
There's a lot of risks that you take, and this is not risky at all. I do recommend anyone that has a thyroid problem with nodules like we do, you know, you have to look into this procedure first before anything else.
I think that too, like both of us had the same thing where our thyroid function was actually normal when we had thyroid labs taken.
Yeah.
And in a situation with a person who has normal thyroid function, you don't want to lose that thyroid gland because it is so vital to every function in our body. And so the fact that this procedure allows us to preserve the thyroid gland, I think is what makes it so amazing. And I think so many more people, because thyroid nodules are super common. I don't know if you know this statistic, but something like 50 to 60% of people have thyroid nodules. For people to go to a doctor and they have nothing wrong with their thyroid function, but they have these growths on them, and the doctor says, well, let's just take your thyroid out, that can be very, you know, disempowering. And it's scary, yeah. So to know that
when they told me that I had to get surgery, they were talking about like within months, because it was immediate. Yes. Because it was so bad.
Yes.
And it was affecting me in so many ways. So the only option at the moment that doctor could provide me was surgery. I was like, no, this could not be the only thing out there.
Yes.
So, and thank God I bumped into Dr. Quo.
And I have one other question for you regarding Dr. Quo. Was it a big drive or distance for you to get to see Dr. Quo? Did you have any obstacles?
No, I actually live walking distance from the hospital.
Oh my goodness.
And I walked to the hospital and I walked back home.
Wow, how convenient.
That's how amazing this thing is. Yes.
Wow.
I was actually just walking. Because I didn't feel anything.
Wow.
I was just walking with my ice pack and that was it. No pain at all.
Wow.
But I took the ibuprofen just in case I experienced strong pain. But it was just like a discomforting pain. Like it wasn't something that like comparing to a toothache or an actual incision.
Well, that's amazing.
I actually walked after the procedure. That's how safe it was.
That's awesome.
I tell you, it was just like the anticipation mainly that got me a little nervous. But to go through the whole experience, it's very safe.
I'm so glad that you have such easy access to Dr. Quo and this. I actually have spoken to people who live on the other side of the world and they're willing to fly to the United States to get this done. I live in the state of Alabama and I drove to Virginia to have mine done. And to me, it was worth every hour on the road. It was worth having to, book an Airbnb. It was worth it to me because I got to keep my thyroid. And so, but I'm so happy for you that it was so easy for you to access it and that you've had such amazing results and that it's helped you in so many ways. So thank you so much for telling me your story today.
My pleasure.
And I think it's going to resonate.
Just make sure that you do your investigation before you.
Yes.
And the first way to start is to investigate about the RFA. It needs to be an active choice instead of just going for surgery right away.
Yes.
Like, no, that shouldn't be the only option.
I always say at the end of my videos that people need to educate themselves and be their own health advocate. And I don't say that just because it sounds good. It's really true. It's very, very important that we have an active role in that and not just a passive, doctor says you need surgery, okay, I'm gonna have surgery. Not saying that surgery is bad all the time. There are definitely cases when it's necessary. But in a situation like this where, you've got benign nodules, they're not cancerous, so you're not in any danger of that. But you have these other concerns, it's such a good option. And so I'm so thrilled for you. I really appreciate you taking the time.
I actually consulted with about 4 doctors before seeing Dr. Quo. 4 doctors, 2 ENT and 2 endocrinologists. Wow. And all of them, they were telling me, no, you have to do the surgery. I was like, no. I had hope that something else, so I'm very thankful to whoever invented this. This is a really, really safe procedure.
Thanks so much for watching today. If you liked this video, give it a thumbs up and don't forget to subscribe and share it with someone you know who has thyroid nodules because let's face it, most people do. Never forget to educate yourself and always be your own health advocate.